So Jim, plantar fasciitis is something that a lot of us hear about, but I think that a lot of people don't necessarily know what it is. So what is plantar fasciitis and who is affected most by it?
Plantar fasciitis is inflammation of the plantar fascia, or the bottom side of the foot.
Okay.
Normally present with pain in the heel all the way to kind of the toes, okay, as far as things go. Pain usually first thing in the morning when standing initially, and then will get better as the day goes. And as plantar fasciitis progresses, you'll have pain as you're standing throughout the day as it worsens. People typically affected can be anybody as far as things go, but more often than not, it'll be people that present with either too high of an arch or no arch at all. And the older we get, the more common it becomes. And then also people that are usually standing for longer periods of time during the day, nurses, people such as ourselves up on our feet all the time, or factory workers.
Okay. Now, are there stretches that you can do to avoid plantar fasciitis?
You try to maintain heel cord flexibility or flexibility of the calf muscle, so like a runner stretch, things like that are very good.
Okay.
Another stretch of the plantar fascia itself, such as rolling your foot over a tennis ball, a baseball, something of that sort to stretch out the plantar fascia, but trying to maintain flexibility in the lower extremities,
okay,
the legs itself.
You were asking before the interview started if you could use my shoes as an example of a poor example of footwear for plantar fasciitis. Does one's shoe wear affect plantar fasciitis?
Yeah, absolutely. If you are starting to have symptoms of plantar fasciitis, you definitely want to get into a shoe that's more supportive. So such as like a running shoe or walking shoe, or if you're wearing dress shoes that have more of a sole or stability in the shoe itself. Stay away from dress shoes that are very flat and no support as you're picking up the shoe, and you can bend it fairly easy. That's not going to be much support. Males, staying away from hard, firm dress shoes with that kind of that really firm bottom there as far as things go. And then as we get this time of year, flip-flops are horrendous. I mean, there's no support at all, and there's a lot of things going on. So you'll have a lot of people that start to increase symptoms in the summer with flip-flops too.
So are there any other tips or suggestions that you have when it comes to plantar fasciitis? I mean, especially for people who are on their feet all day, what kind of suggestions can you give?
One is maintain flexibility, a lot of stretching if you can as far as things go. Proper shoe wear, and even I'll talk to people even as you're working throughout the house, find a pair of shoes that's just comfortable to wear. If you're doing housework, don't go barefoot even in the house itself when it gets to that point. Other things are strengthening, maintaining strength of the foot. There's a lot of little muscles in the foot that we want to maintain strength of, so they're doing certain toe raises or toe curls, and there's little activities that you could do as far as strengthening goes. But and staying active, maintaining weight is very important. The more weight that we gain, the more stress is placed at the bottom of the foot through the plantar fascia.
And then you mentioned physical therapy, even the calves. How does one get started with physical therapy if they feel like they are suffering from plantar fasciitis and maybe really do want to get into a physical therapy program to help themselves? Would
be contact your physician for referral to physical therapy. And then with plantar fasciitis, such as things, we've talked about flexibility, the strengthening of the feet, different things like that we will give you, balance activities, education and shoe wear. And then we'll also do things as far as mobilization of the soft tissue, trying to stretch the plantar fascia, break down basically scar tissue that may have formed from chronic pain in the plantar fascia.
Right.
And then could be things as far as looking at inserts or orthotics even into the shoes as far as that goes.
So there really are a lot of things that can be done if you feel like you're suffering from pain. I know Indiana Physical Therapy, you have 10 locations, is that?
We do.
So you make it really convenient for people. Your hours are convenient. So if people feel like they're suffering, there are a lot of things that can be done, not only for plantar fasciitis, but for several different areas of pain management.
Absolutely.
It's just a matter of getting that doctor's referral and coming in and seeing you guys.
Yep.
All right, well, if you are suffering from plantar fasciitis or any number of different symptoms, be sure that you go to your doctor, get a referral, and come into Indiana Physical Therapy. Check them out on the web or give them a call today, and we will be right back on Insight.